Good morning. This is the fifth episode of Mind Your Mind. This is a joint initiative of Dr. A.V. Baliga Memorial Hospital, Udupi, and One Good Step. Basically, the aim of these presentations is to create awareness about various mental health issues. So, one of the things we did was the first four episodes were basically on the common mental health problems and how to be aware of these health issues, and in that we took up depression. So in the last four issues, what we realized was our viewers had a lot of questions. We are actually thankful for the support by the viewers. So this particular program will be dedicated only to few of the top questions which we felt needed to be addressed by a psychiatrist. Depression is a medical illness. It is just like diabetes and hypertension. The basic problem is in our country, what is happening is we feel that we equate the psychiatrist with a madman's doctor. That should go. Of course, more and more celebrities like our Deepika Padukone, so many of them, even few of the cricketers recently I was seeing, they have come out openly about their psychological illnesses like depression. They have said that they have taken treatment for depression. So basically, these are certain things which can help improve the reduce the stigma for depression. So one thing is declaring that you have had this problem yourself and you have taken help. See, but we are living in a country where I think even some celebrities do not even declare that they are having diabetes and hypertension. So this is the major problem. Please understand that just like hypertension and diabetes affect the body, depression can affect the mind. It is a illness due to chemical changes in the body. So declaring that you are visiting a psychiatrist, you are taking treatment from him, and what are the reasons why you had to take treatment from him will bring about a paradigm shift. I know it is difficult, but it is the truth. Another thing is when a loved one is suffering from depression, please give him support. Please don't misguide him or dissuade him from taking proper treatment for depression. This is an excellent question. In fact, first thing is I would suggest please take your loved one to your treating doctor or a clinical psychologist or the psychiatric social work consultant, because they will be able to tell you and your relative in a better way. So don't hide this particular thing that you are being treated from them. You can sensitize them, but also allow your doctor to sensitize them. Then what happens is they will get the full picture. Then second thing is they should be aware of what is this depression. If you see the previous four videos, there are a lot of informations on the clinical features of depression. So I would suggest you that you can see the previous four videos. You will get a lot of information which can be passed on to your relatives. And also tell them that it is not many of your behaviors could be, it is not that you are doing it deliberately, but it is because of depression you behave like that. And whenever you are doing it, relatives should remind you, look, what you are doing is wrong, it is a part of depression, or it is a behavior that is secondary to depression. So when they sensitize you, like you will be avoiding going to work, then if the relative tells you this, then you feel angry with them. You should not be angry with them. Try to follow them. Try to forcefully go out. Tell your relatives to forcefully take you to work or even to visit a psychiatrist, because what I have seen is in this particular situation, many times you start avoiding doctors, you start avoiding going to a therapist, you start avoiding going to work. All this should stop. So relatives will become more comfortable if you listen to them. So you confide in them what is your problem and why you are behaving like this. So let there be a proper discussion. So this will help your relative to understand you better. And for relatives, I again tell you, don't think that depression can be improved by some pep talk. No pep talk can make a person better. No pep talk can cheer up a person. Many times the clinical depression requires treatment, as I have told you, medical treatment or counseling. So this is something relatives should understand. There is no point telling them your experience and how you have felt bad in certain situations and how you have overcome it. Instead, listen to them, then tell them to take professional help. Tell them, go and meet the therapist yourself. You also can go with the patient. So these are the ways by which you can help them, and also see that they take the dose of medications properly every day. Then the next question. See, as far as a professional, what I do is when I see some patient, I do not even discuss with my wife or my son or my mother. I do not tell them so and so is my patient. In fact, even in our hospital, we tell our staff, we tell them very clearly that they are not supposed to discuss about a particular patient. They should never disclose to them that this particular patient has visited the hospital. And even when it comes to when we meet this patient outside, we never tell that such and such a person is my patient. But the beauty of this, what do you say, the current society, where, as I told you, there is a shift in at least attitude of some people. I have seen patients very clearly telling that I am being treated by Dr. Bhandary. There are people who have told on stage. But as a professional, as professionals, we maintain very high degree of confidentiality. We never discuss, you would understand, we will never discuss with non-medical people or even medical people unless it is for a reference. See, somebody suffering from depression also develops hypothyroidism, has also got vitamin D deficiency, and we are treating. At that time, when we refer to the physician, we will ask him, we will tell him, see, such and such a person is having depression. Can this be because of vitamin D and hypothyroidism? These sort of things we will have to do when this is called as a prevalent communication. And of course, in a court of law, we usually do it with the protest. We tell the judge that I am not supposed to tell, but in the court of law. And many a times I have asked the judge to give me a private audience where I talk about the issues discussed by the patient. So this is the high degree of confidentiality we have to maintain. Every district headquarters, district hospital has a team of psychiatrists, clinical psychologists and psychiatric social worker. Every medical college has a psychiatrist, psychiatric social worker and clinical psychologist. Please take help from these centers. And of course, centers like NIMHANS, then Dharwad Institute of Mental Health and Neurosciences, then those government colleges where they have psychiatry department, the treatment is free. There are clinical psychologists who can impart counseling, and of course there are a lot of NGOs working in the field of mental health, like the Samadhana Counseling Center being run by one of our very esteemed psychiatrists, Dr. C.R. Chandrasekhar, and there is what is called as the Prarthana Counseling Center run by Mrs. Pankajamma and Shanta Nagaraj. They all offer counseling, they offer facilities of free counseling, and we at AV Baliga, we have been helping people regardless of their financial status. Anytime you want any help, at least people of Udupi, I request you, please meet us, please tell us that you cannot afford, and whatever help we can do, we will do it. So please take help of this particular this one regarding uh, counseling, and see that you get rid of your problem. It's a very wide question. I think I would take it up maybe in one separate issue, but still, since this has been asked and since this has been selected as one of the most important questions, I thought I will answer here briefly. See, it is not that the prevalence of mental illness has increased drastically, but the awareness has increased. Let me tell you. Because what is happening is, now with the advent of social media, even this YouTube channel is a part of that, we are giving lot of information. So people are getting lot of information about mental illnesses. So naturally they are coming out to take help. And of course the scientific temper is increasing, because what they used to do is, in the olden days, one is there were no psychiatrists. Second is, even if there were psychiatrists, there was no awareness. They would go to an astrologer, talk about their sukha, dukkha, sit with him, probably get some solace, but the medical angle was lost. So now the medical angle, the scientific temper, awareness regarding medical, medical basis for depression, medical basis for schizophrenia, all this has improved. So everybody now understands that this is due to some chemical change in the brain. So they are visiting the psychiatrist. So I would rather say that I don't see a drastic increase. But yes, post-COVID era, we have noticed that maybe because of the stress of COVID, maybe the illness per se, then of course the socio-economic aftermath of COVID, and of course lot of issues like lockdown, lack of ability to mix with people, especially when you were old, you are not allowed to go out, or you lose near and dear ones. All this has definitely brought a slight increase in prevalence of late. But if you compare yesteryears, maybe 10 years ago, the awareness was less. Probably we'll have one program in the next this. So dear friends, I think I'll stop at this. This is an attempt to answer the audience. We want this channel to be bi-directional. We want you to participate. We want you, our only aim is to create awareness about mental illnesses. And please understand, this is not a substitute for any psychiatric treatment. Whenever you are ill, whenever you find out from our programs that this is a mental illness you are suffering from, please visit the nearest psychiatrist or clinical psychologist or the psychiatric social work consultant. So this is my request to you. This is a joint effort of A.V. Baliga Memorial Hospital, a hospital working in the field of mental health for the last from 2003 for last 19 years, and One Good Step, a NGO which is working in the field of health and education. So our aim is to create awareness. I would request you, be aware of your problems, accept your problems, analyze what you can do about it, and take action. If necessary, go and take treatment. Thanks for the patient listening. Jai Hind.